Good afternoon, dear students of second division. Our today's lecture is hospital hygiene. You are future doctors because this topic is very important for you as for doctors. But in India and in other countries you have such your specific features, but I think total requirements are same for all countries, for all hospitals. Plan of today's lecture. We must discuss some groups of questions. First of all, definition of hospital hygiene, problems and questions which elaborate by this section of hygiene. Next question, hygienic characteristics of different kinds of hospital construction, hygienic principles for the placement of hospitals. Next question, medical and protective regime of the hospital, or by other word, it's work of hospital. Next question, hygienic requirement to the ward section and ward. Hygienic demands to operation unit and operation theater. Next question will be about infection department. And some questions due to nosocomial infections, because it's a very big problem for all hospitals in the world. And we will discuss reasons, agents, sources of occurrence, and ways of transmission of nosocomial infections, and prophylaxis. And last question will be about hygiene of medical staff work, because in medicine we have also some features at the medical staff, and doctors, medical nurses contact with main substances, factors of negative nature, and it may cause some problems with health at them. And now we should begin. First question about concept of hospital hygiene. Hospital hygiene elaborates standards and requirements for the placement, planning, and sanitary technical provision of all medical institutions. Creation of optimal hygienic conditions in hospital premises is a powerful healing factor for patients in the overall complex of medical measures. At the same time, hospital buildings and premises should provide a high level of favorable working conditions for medical staff who provide treatment and service to patients. And now concept of hospital. What is hospital? Hospital is a medical center consisting of a complex of interconnected buildings designed for medical care of the population and diagnosis of diseases, ensuring effective treatment of patients, creating optimal conditions for patients and medical personnel, exclusion of the spread of nosocomial infections. What are kinds of treatment and prophylaxis institutions? First of all, it's hospitals. Hospitals may be of different types, for example, regional, city hospital, hospitals of certain specialty, to cardiovascular, for example, hospital, or antituberculosis hospital, or children's hospital, and other types. It may be polyclinics. It's also medical institution, polyclinics, dispensaries, In our country, we have different types of dispensaries: antituberculosis, venereologic, oncologic, psychoneurologic, and prophylactic and diagnostic centers. It's a big new medical centers where patients may receive diagnostic procedures and some treatment measures and treatment of diseases. But first of all, such centers is directed for diagnostic of diseases. Classification of hospitals. Maybe different kinds of hospitals. By structure, hospitals are shared on general structure, regional hospital, city hospital. It's our usual hospitals where many departments are located. And specialized hospitals, for example, infectious, dermatovenerological, psychoneurological, oncological, cardiological. What means specialized? Usually such hospitals need in special requirements and special conditions. If infectious hospital, it must be isolation from other departments. And antituberculosis also. Then oncological, other requirements, maybe some requirements to territories, to some departments of oncological hospitals, because such hospitals belong to specialized type. And now we should discuss different kinds of hospital construction. Many years ago, hospitals were of specific system of construction. Usually it was pavilion type. When woods were absent, and all in one building, many beds and many patients were in one big premise. But I think it's not a vital question, and now we can discuss modern types of hospital construction. Some of them now not modern, but we have such hospitals. There are four main types of hospital construction. One of them decentralized system, and decentralized type of hospital construction is typical for old buildings, for old hospitals. Such hospital consists of separate 1- and 2-story buildings. Such development ensures the prevention of nosocomial infections. It's the main privilege of such type of construction. Low-rise buildings make it possible to actively use the hospital garden for walk-in patients. It is easy to create a favorable medical and protective regime. But later, providing specialized care to patients with the territorial isolation of departments has become difficult. Because what means decentralized system? It's many separate buildings. It turned out to be economically unprofitable to have expensive medical and diagnostic equipment in each hospital building. The next stage of hospital construction was the centralized building system. All the functional divisions of the hospital, treatment departments, polyclinic, administrative premises are located in one multi-story building. It became possible to more effectively efficiently use all medical and diagnostic rooms. The conditions for the operation of sanitary devices and equipment were facilitated. The path of movement of patients and personnel were shortened. The delivery of food from the catering unit was accelerated, and construction and operating costs were reduced. A significant advantage is the reduction in the area of the hospital site compared to decentralized type of construction. What we discussed two types of construction, decentralized and centralized. In Simferopol, example of centralized system is hospital number 6. If you know hospital number 6, it's example of such type of construction, one big building. Decentralized system may be example our Crimean Republican Hospital Semashka. It's example of such all decentralized type of construction. And next type is mixed system. However, many departments in one building create certain difficulties in organizing a medical and protective regime and preventing nosocomial infections, making it difficult for patients to walk in the fresh air. A mixed building system appeared. The admission department and all the main somatic and clinical diagnostic departments, for example, X-ray, physiotherapy, clinical diagnostic laboratory, pharmacy, are located in the main building. And other premises such as polyclinic, maternity, children's infectious diseases departments are in separate buildings. Separate buildings have administrative services and pathological department. Example of such a mixed system in Simferopol is hospital number 7, where all main departments and administration in one big main building and some others departments, maternity, infectional department, in separate buildings. But I won't say you infectional department always must be in separate buildings. Later, it became possible to build large multidisciplinary hospitals. The mixed development was modernized and became known as the block system. In a block system, all departments occupying independent buildings are combined into one common block and connected by passages. Infectious and radiological departments, as well as support services, are taken out to separate buildings. So the last type of construction, the most modern type of construction, is centralized block system, or maybe block system. It's same, centralized block or block system. What means centralized block system? When several one very big building consists of some blocks, and all these blocks are connected by passages. And usually in one block maybe departments, medical departments of surgical type. In other block maybe therapeutical departments. At the other block maybe services and laboratories and some additional premises. No, and In modern hospitals, the greatest changes are at treatment and diagnostic departments in connection with the development of new methods of treatment and diagnostics. The working areas of these departments are increasing. Examples of such departments of new modern departments are Department of Hemodialysis or departments for transplantations of organs, and because in such a block system, maybe some free territories, some free maybe some story for for location of some new departments in these free territories. So maybe some stable blocks or maybe such so-named free territories, free block. Next question which we should discuss is hygienic requirements to placement of hospitals. In the city plan, hospitals are located on the outskirts and in a residential area. General somatic hospitals are located as a rule within settlements specialized for patients with a long treatment period in the suburban area. Example of such location may be anti-tuberculosis dispensary. Usually it's in suburban territory, suburban zone. Hospitals should be away from highways, must be well ventilated, reduced percentage of development, proximity to urban passenger transport, and city-wide engineering facilities, water supply and sewerage. The shape of the plot usually is rectangular to accommodate buildings with windows to the south and southwest. It's requirements in our conditions, because we live in territory where not very hot climate, because orientation of windows must be on south. And now requirements to hospital site in numbers. Area of hospital site. Area is calculated from number of beds. It depends, area of hospital site depends on number of beds in the hospital. And these requirements we should account at planning and construction of hospital. For example, we have small, usually it's very old hospitals, only in 50 beds. Calculation must be 300 meters square per one bed. If big hospital, opposite dependence, if big hospital in 1000 beds, area 60 meters square per one bed. I said about rectangular form of the site, presence of plantations of plants in territory of the hospital site by hygienic requirements should be 60% of area. It's very high percentage, but it's normal for optimal sanitary conditions in the hospital. But at such number of plantations in hospital site, maybe more optimal conditions for patients. Building up to 15%. Because it's percent for medical buildings. 15% of all territory must be on medical buildings. And distance from medical buildings to service zone usually not less than 50 meters. And obligatory must be convenient approach roads to the hospital site, minimum two. Usually one way to the main entrance to the hospital, and second one for service zone. For service zone and for usually it's combine of pathological department and service zone. This must be separate road for this part. And now we should discuss question due to functional zoning of hospital site. Usually our hospital sites consist of 5 functional zones. It's zone of polyclinic, more correct when this zone separately from main building and with separate individual entrance. Zone of medical buildings, next zone, where must be departments, buildings for infectional department and for others non-contagious patient departments. But it's one zone of medical buildings. But I said you infection department always in separate place and in separate building. Next zone, pathology anatomy zone, zone of morgue. Service zone and gardening or green zone. Such 5 zones. I said your gardening zone must be 60%. Service zone, it's garage, kitchen, premise for sterilization. It must be as a separate zone. And now question about medical and protective regime of the hospital, or hospital regime, or hospital work. It's all working conditions and all measures which must be in each hospital. It's complex of measures directed at rapid restoration of patients' work capacity or patients' health. This complex includes 4 main groups of measures, activities. First of all, treatment and diagnostic measures. It's the main group of measures. It's main type of work of the hospital, because hospital, first of all, is necessary for treatment and for diagnostic of diseases. Next group, hygienic measures. Administrative activity, because in all medical institutions and in not only medical, in all institutions we have the head administration, because administration is leading part of personnel, and it's obligatory presence in all institutions. And household service. It's all additional services for providing optimal normal work of the hospital. It's provided by drugs, by food, providing optimal microclimatic conditions, optimal state of air, provided by equipments, by all necessary substances which are necessary for the normal work of the hospital. And now, what means hygienic measures? Hygienic measures include optimal selection of hospital site, its functional zoning, correct functional zoning, optimal placement of departments, optimal placement of ward sections and wards, hygienic demands to hospital premises, its elaboration of standards for microclimate, light, ventilation in the hospital premises, its elaboration of center anti-epidemic standards and prophylaxis of nosocomial infections. Organization of rational and medical feeding. Its personal hygiene of the patients and staff, and the optimal working conditions for staff, prophylaxis of occupational diseases. Composition of hospitals of general structure. All hospitals have some usual departments. Admission department, medical departments for treatment of patients, polyclinic, diagnostic departments, services, and administration part. Administration department. Functions and composition of admission department. Lobby with registration, admission of patients. Doctor's cabinet, inspection room, express laboratory, where diagnoses are made and physical examination of patients also made. Inspection room for emergency assistant and sanitary room, bathroom, toilet for washing patients. And now we shall discuss question due to ward section. What means ward section? It's a functional unit of any departments. It's our usual construction, and usually I give you example, hospital number 7, if you present attended for hospital number 7, you can see in one department 2 parts. One this part of the department is ward section. It's usually it's a half section of department. And total number of beds in such department, in such ward section must be 25-30 beds. No, and what is composition of ward section? First of all, it's wards. Wards with different number of beds. Obligatory must be 1 bed wards, 2 beds wards, and 3-4 beds wards. It's normal number of beds in the hospital. And must be 60% of all wards on 3-4 beds, and same by 20% 1 and 2 beds wards. And it's a doctor's cabinet, it's a procedural room, post of nurse, buffet, bathroom and toilet, and hall. Usually patients eat in hall. No, sometimes maybe special room for eating. What are these are main components of any ward sections. And maybe different types of corridor. Now you can see plan of general ward section, where wards, corridor, post of nurse, treatment room, nurses room, material room, and bathroom, toilet. Width of corridor. It's important for the movement of wheel stretch. For turnaround wheel stretch must be minimum 2.4 meters. More better if width of corridor is 2.4 meters. Next question. We return to what section? Types of corridor. Maybe different types of hospital corridors. Maybe one side corridor and by side. What means one side corridor? When all wards from one side. It's in Simferopol, it's hospital number 6. When all doors for the wards from one side, from other side only windows. Such type of construction of hospital corridor construction more optimal for good ventilation. So we can open windows in the ward and door and opposite window in the corridor, and it will be good ventilation. Maybe by side type of construction when from both sides wards, and such type not from hygienical positions, not optimal, but more economic. Such variant more economic because at one side construction very long department. Next question: hygienic requirements to hospital ward. Area. Calculation of area. It depends also on number of beds. If several beds in one ward, area calculated from 7 meters square per one bed. If ward only in one bed, minimum must be 9 meters square. In intensive therapy department, area 13 meters square per one bed. For the children, 6 meters square per one bed. So here different standards. Usually we say about 7 meters square because more often we have some beds wards. Height of the ward and all other premises in the hospital must be minimum 3 meters. And we discussed this, noise level at night in the hospital ward is 25 decibels. Microclimate. Also we discussed temperature here 22 degrees Celsius, relative humidity 40-60%, air velocity 0.2-0.4 meter per second. Ventilation. But air velocity, air velocity must be lower, up to 0.2. Because it's for living room, it's normal. For classrooms, it's normal, up to 0.4. For the hospital ward, optimal 0.1, 0.2. Ventilation. CO2 up to 0.1%, multiplicity of ventilation 2-3 per hour, volume of ventilation minimum 20-30 meter cube per hour per bed, but optimally twice more. Lighting, natural light factor 1 to 5, 1 to 6, FNI 1%. Artificial illumination, artificial light, common 40-50 lux, local 100 lux, and night light 3 lux. Now we should discuss question about hygienic demands to operation unit. In operation unit, Relatively, we may estimate we can reveal 4 types of premises by degree of sterility. Such zones are 4, and first of all, it's sterile zone, properly operation theater. The most higher requirements to operation theater, because it operation theater we estimate as sterile zone. Next zone of strict regimen, pre-operating room and room sterilization room. Next zone of restricted regimen, it's narcosis equipment room. And zone of general hospital regimen, all other premises in operation unit. Cabinet of doctors, nurses room, room for no, that's all. Total, it's first of all, it's premises for medical staff. No, and here you can see plan of operation unit, where operating room, narcosis room, sterilization room, pre-operative room, also corridor with width 2.8 meters, and others rooms. Its usual operating unit. Where must be operation unit? Our recommendations is place for operation unit must be in separate separate territories, in separate premises, not inside of surgical department. Because if operation unit will be inside of any department, it may be high risk of nosocomial infections. Because optimal place in separate block. For example, what in Simferopol we have such special construction where all operation units in separate big block connected with main building by pass. Such construction more optimal for prevention of nosocomial infections and for service of operational block. Such type of construction more convenient. No, and now hygienic demands to operation theater. Microclimate. You know this data, temperature up to 25 degrees Celsius, humidity up to 55%, light factor 1 to 4, factor of natural elimination minimum 2%. Artificial general light 300 lux and local very high requirements 3000, 10,000 lux because it's elimination from special operational special operational lamps. Ventilation. Only artificial ventilation must be in operation theater. Mixed type inflow plus 6 times per hour, outflow 5 times per hour. And carbon dioxide same with others, premises 0.1%. Microbial contamination of air and height of operation theater must be not less than 3.5 meters. It also is necessary for creation of optimal ventilation for normal pure air in the operation theater. And it will be prophylaxis of microbial contamination. Such special requirements, total microbial number before operation must be not more than 500 and in 1 meter cube, and during operation 1001 meter cube If we review higher numbers, it says about pollution of air, operation theater air. Number of staphylococcus before operation should be absent, and during operating time, not more than 4 in 1 meter cube. And the total area of operation theater is calculated from number of operational tables. But by hygienic requirements, in one operation theater must be one operational table. Area of such operation theater is 36 meter square. If sometimes maybe 2 operational tables, it's for such operation theaters as a requirement, 54 meter square, but it's not official requirement. No, it's not official requirement. No, and next department which we must discuss is infectious department. General demands to infectious department must be, I said you, special functional zone on hospital site, 2 entrances, one for patients and other for personnel. Sewage from infectious department before dump in the city water drain must be disinfected by high doses of chlorine. Norm of residual chlorine 3 milligrams per liter. No, and special kinds of wards in infectious department. These kinds are box and half box. What means box? A box is complex of premises for presence of one patient, sometimes for 2 patients. First of all, boxes are used for severe infections, for example, for patients with cholera, where must be strict isolation of patient, and for patients with unknown etiology infections. Just when doctors think about infection or disease, but not reveal what kind of infection. Also must be isolation of such patients. Box consists of 4 parts, 4 premises. Properly ward, sanitary room, toilet with wash, and 2 small corridors. One corridor for patient, and this corridor is for entrance of patient to getting patient to his ward from open air, and other small corridor for medical staff. This corridor between total corridor of department and ward of this box. Total area of box is 22 meters square, and for 2 beds in one in one bed 22 meters square, in 2 beds 27 meters square. Half box. Difference of half box from box is absent of external corridor. Only 3 components in half box: wood, wood, sanitary room, and internal small corridor for medical staff. For medical staff, for patient. No, and here you see boxed ward. Boxed ward means presence of partitions between beds. Such type of wood is used usually in the pediatric departments for children. Such type of wards is used for children in pediatric departments. No, and sometimes maybe in infectious department. Так, ну, now we can make a short break, 5 minutes. Сережа, здрасте, говорить можешь? Слушай, а ты слышал про этот, читал, что какие-то курсы будут опять организованы по современным каким-то там технологиям? А ты не знаешь, куда идти, как туда записываться? Ну, не знаю, там мне Бутырский сказал, что он ничего не увидел. Поэтому он мне пойди узнай. А ты... Ну да, тогда еще записывалась по учебному году. А, ты writing был. Ага, ну спроси, пожалуйста. Если ты что-то знаешь, ты мне напиши, ладно? Или, я не знаю, или пойти в учебный отдел. Просто ходить особо некогда. Я сейчас на лекции, а потом у меня группа. Уже группа. Ну, где здесь на территории. Да. Ага. Вот. Нет. С 25-го. Сегодня 23. Узнаешь, ладно? А во сколько тебе позвонить, узнать? Напомнить, может быть. Ну, в общем, где-то если полдесятого тебе позвонить, то нормально? Ну, 10. Ну, хорошо, да. Все, спасибо. Что такое? Боже, ну кошмар. Так, ну там не кури на балконе, то придется. Боже. let's continue. No, and now we should discuss a very important question. It's a question about intra-hospital or nosocomial infections. Intra-hospital infection, by definition of World Health Organization, any clinically manifested disease of microbial etiology occurring within patient's stay at the hospital or visit to the doctor, or disease of medical staff occurring as a result of care of infectious patients. Thus, it's not obligatory problem for patients. It may be problem for medical staff also. And here you can see basic groups of nosocomial infectious activators. Here many types of microbes. Gram-positive cocci, for example, Staphylococcus aureus, causes wound infections, infections of urinary tract, infections of skin and soft tissues, purulent mastitis, bacteremia. Staphylococcus epidermidis cause bacteremia, endocarditis, surgical wound infection, post-operation infections of eyes. Beta hemolytic streptococcus causes surgical wound infection, infections of burn wounds, puerperal infections in obstetrical hospitals, infections of newborn. Streptococcus pneumonia causes bacterial pneumonia, purulent meningitis. Streptococcus cause puerperal infections, wound infections, skin infections. Enterococcus cause infections of urinary tract, bacteremia, endocarditis, abdominal and pelvic infections. Surgical wound infection. Gram-negative bacteria. Enterobacteria cause infections of urinary tract, for example, Escherichia coli, pneumonia, surgical wound infections, diarrhea, Salmonella typhimurium, bacteremia, Escherichia coli, Enterobacter, Klebsiella pneumonia. Blue pus rot causes bacteremia, pneumonia, infections of urinary tract, infections of burn wounds, surgical wound infections, infections of eyes. And Legionella fungi, mainly Candida species, and viruses. Structure of hospital-acquired infections in the world. More often, it's infections of urinary tract, 15–40% of all cases. Surgical site infections, 10–30% of all cases. Respiratory infections, 16–20%. And intestinal infections, 10–20%. Among respiratory infections, it may be pneumonia or bronchitis. Surgical infections, first of all, it's complications after operations. Getting microbes in the wound may cause some purulent disease, purulent occurrence of purulent wounds. And others, maybe other kinds of nosocomial infections. Sources of hospital-acquired infections. Primary sources are patients, medical staff, and visitors. More often, sources of infection may be other patients and medical staff. Secondary sources, objects of hospital medium, instruments, linen, nutrition, furniture, and from air also. No, and basic ways of nosocomial infection transmission are aerogenic, aerial drop, aerial dust, contact through instruments, through linen, through furniture, fecal oral, through dirty hands, and nutritional. Nutritional through meals. I think the most often ways of transmission aerogenic and contact. Very, very seldom nutritional because through meals more often it's contact and aerogenic. All objects of hospital medium may be shared by some categories due to dangers of nosocomial danger of nosocomial transmission. These categories are critical, half critical, and not critical. What means critical objects? It are surgical toolkit and needles, endoscopes, catheters, because very difficult sterilization of such instruments, such objects, because they are more dangerous and belong to critical category. Half critical equipment for narcosis and inhalations. And not critical all other objects of hospital medium as linen, furniture. System of prophylaxis. Prophylaxis of nosocomial infections includes some group of measures. And first of these groups are sanitary anti-epidemic measures. What means sanitary anti-epidemic measures? It's sanitary anti-epidemic regimen, constant bacteriological control and sanitation of air, revealing and isolation of contagious patients, regular medical control of staff members' health, following rules of personal hygiene by patients and staff, following the demands to cooking unit of hospitals and quality of meals, and shortening patients' stay at the hospital. We think this measure is the most optimal and the most effective. Because if patients during long time present at the hospital, he has more higher risk of nosocomial infections, because our recommendation shortening patient stay in the hospital. And it's usual tactics of doctors. Maximum diagnostic measures must be before hospitalization, and at the hospital only treatment, confirmation of diagnosis and treatment. And after hospitalization, patient may continue his treatment under control of polyclinics doctor. Next group of measures, disinfectant sterilization measures. Sorry? Да. Ну что, скоро придет. Папа дома же? Понятно. Так, все, Игорь, у меня лекция. Все, давай. Adequate disinfection and sterilization of critical and half-critical objects, sanitary processing non-critical objects. Next group of measures: architectural planning, isolation of ward sections, wards, surgical unit, usage of boxes, half boxes in infectious departments. Optimal placement of hospital site, adequate system of hospital building, functional zoning of a hospital site, and keeping hygienic norms to the area and cubage of hospital premises, ventilation and air conditioning. And increasing last group of measures, increasing patients' resistance. Rational and treatment feeding, sufficient stay on fresh air, optimal motion regimen, scheduled and emergency immunization. No, and our last question, which we should discuss today, hygiene of medical staff work. Many specialties, many types of specialties in medicine have negative contact with negative factors, with infections, with maybe sometimes it may be trauma, and others negative factors, negative microclimate, non-optimal microclimate, and others negative conditions of work at medical staff. But the most high level of morbidity is observed in surgeons and anesthesiologists, at X-ray and radiologists, and physiologists. No, and doctors of infectious department also. Among the numerous medical specialties, the work of anesthesiologists occupies a special place. The anesthesiologist often finds himself in a variety of work situations, usually unpredictable, associated with the control of vital processes in the patient's body. The anesthesiologist works with precision equipment that requires not only practical skills but also technical knowledge. The professional actions of anesthesiologists require dedication, prolonged attention and a quick assessment of a variety of information. These moments of work make high demands on the intellect and the neuro-emotional sphere. The level of anesthetics in the operating room may be increased. These concentrations in the breathing zone of anesthesiologists are maintained throughout the operation. In the blood of anesthesiologists, the concentration of anesthetics is from 3.5 to 8.5 mg per cent, which is only 1.5 to 2 times lower than the corresponding indicator in the operating room air. Complaints of doctors about headaches, increased fatigue, sleep disturbance increase with increasing length of service. Anesthesiologists are characterized by an increased incidence of conjunctivitis, tonsillitis, and acute respiratory infections. Hence, it becomes necessary to regulate the working conditions of anesthesiologists and to reduce the concentration of anesthetics in the air. The work of surgeons is very diverse. It makes high demands on the professional qualities and the neuro-emotional sphere of doctors' and requires great physical and mental endurance. Surgical activities range from the finest manipulations under a microscope to operations requiring significant physical effort. For example, trauma surgery. The surgeon must be able to make quick decisions, be consistent in his actions, have a sense of personal responsibility for the life and health of the patient. Fatigue after the operating day is noted by almost all surgeons, regardless of the length of service and the type of medical institution. The greatest fatigue develops after daily duty. Among the diseases of surgeons developing during their professional activities, hypotension, varicose veins of the lower extremities, flat feet. For surgeons of the older age group, 50 years and older, chronic ischemic heart disease and cerebral atherosclerosis are in the first place. Now, in this slide, you can see the basic professional harmful factors which influence on these doctors' action of chemical substances, action of adverse microclimate. Usually it's hot microclimate, when high temperature in operation theater in combination with high humidity, increase of carbon dioxide concentration and decrease of oxygen, psycho-emotional and physical overloads, the forced body position, contact to infectious agents, and frequent infringement of a mode of work and rest. Very often, surgeons and anesthesiologists have not arranged a working day. It may be work at night, at any time of day, at night, and duration of operation sometimes is very long, and all these factors are negative for these specialists. And prevention of occupational diseases in surgeons and anesthesiologists. Usage of devices for providing normal artificial microclimate, air conditioning, here we use air conditioning, centralized oxygen supply to the operation theater, optimal inflow and outflow ventilation, observance of a mode of work and rest, duration of working day in operation theater not more than 5 hours. Dress for surgeons and anesthesiologists must be made of natural materials, providing good ventilation. And change of clothes must be in 4 hours, a mask in 2 hours after beginning of operation, due to loss of sterility. That's all. I finish. Goodbye.